Hello, everybody. On behalf of York Hospital, welcome to today's Zoom webinar. Today, we will hear from three presenters who are all affiliated with the York Hospital Recovery Center about ways the pandemic has increased stress and substance use disorders across our communities, as well as ways to more healthfully deal with these stressors and connect with available resources for people who might need more help. We'll first hear from Eric Haram, a licensed alcohol and drug counselor and the director of the York Hospital Recovery Center, about the impact of social distancing on stress, some at-risk populations, the definitions of use, misuse, and dependence, and shifting societal norms. After Eric, we'll hear from both Dr. Christine Munore, York Hospital Recovery Center Medication-Assisted Treatment Director, and Susie McKenna, who is a social worker and certified recovery coach with the Portland Recovery Community Center, about healthy ways to deal with stress and what to do or where to go if you or a loved one needs help. Before we get started, we have a few quick housekeeping notes to review. Our three presenters will talk for about 35 to 40 minutes and take questions at the end. Unlike a traditional Zoom where you see everybody's faces during the meeting, during this webinar, you will only see the presenter's face and slide. As participants, your audio has been muted, so if you do have a question, you can type it into the Q&A button located at the bottom of your screen. Please don't use the chat or raise hand icons, as those will not be monitored during today's call. If you do ask a question through the Q&A feature and it's not answered during this meeting, you can email us at info@yorkhospital.com and we'll be sure to get you an answer after this call ends today. This webinar is also being recorded and will be available on the York Hospital website and our YouTube channel next week. So now, once again, thank you very much for tuning in today and spending this time with York Hospital. We hope you find the information helpful, and we're pleased to go ahead and get started by turning the program over to Eric.
Great, thanks, Hillary, and good afternoon, everyone. Thanks for joining us today for this community discussion and webinar. Really, we're looking here at the influence of the added stressors during the COVID-19 pandemic and wanting to talk about its impact on substance use, misuse, and substance use disorder that we've been observing here these last now 10 months. As Hillary mentioned, there are three main parts to today that we want to make sure to cover. And we'll be starting with the impact of social distancing on stress. And so we'll move into that. For learning objectives, what we're hoping folks will walk away with from today is that you'll be able to name three examples of ways social distancing has a compounding impact on really what's been routine stress or stressors. We're hoping that participants will be able to identify the difference between substance use, misuse, and dependence, which we'll define, and how the use of substances has changed, particularly during the COVID-19 pandemic. And then lastly, participants will be able to identify community resources for help with substance use problems, to include acute medical settings or care, primary care, specialty substance use disorder treatment, and community recovery resources. So let's start by looking at really the compounding impact of social distancing on stress. I've tried to break this into three particular areas. One, just as it relates to isolation or greatly reduced connections. Some of the items that I think most people are experiencing to some degree is really missing friends. Our social spheres have been greatly reduced. This can result in loneliness. Many people are working remotely. For kids particularly, there's been this concept of making sort of COVID-safe bubbles, right? Identifying some norms or some rules about people that are not living in the same household, in terms of maybe how many days quarantining, or if they had access to testing, negative testing, so that people can connect. These, in fact, are very, very difficult to create and sustain. And what we're observing for kids particularly is that's really, really difficult, right? There's all the normal stressors of who are my friends and hanging out and where are we going and what are we doing. and then you add the complexity of that of some pretty stringent rules or norms about what makes a COVID safe bubble. And you just get in, and then you have, to go get your wisdom teeth out, and you fall out of the bubble, or you go have a primary care visit, or a parent becomes ill, right? Any number of different things that can impact that. And so the other areas that are important are financial strain. We've seen a great deal of layoffs, of furloughs, reduced hours, people's personal time off banks or sick days running out or needing to be used during times of reduced hours or furloughs, creating significant financial strain. Family stressors, right? Living on top of one another for really now long periods of time. We love each other, but it's good to get out, right? And greatly reduced diversity of socializing. Your sphere has shrunk considerably to oftentimes just the people living in your house. And within that dynamic, you've got competing schedules and bandwidth. If your homes are like mine, there might be 3 or 4 different Zoom activities going on at any one time in corners of the house, garage, or yard, virtual backgrounds in play, and you've got reduced bandwidth, noise, sound, privacy, all of those things that get constrained. And those also contribute to some of those family stressors. There are some populations that we know to be more at risk during this time, and it's important for us to all be aware of this. First, really, people with existing mental health or substance use conditions, really the population we're here to talk about today. Folks may experience increased distress and trauma symptoms. Treatment may be disrupted or is disrupted, and care providers and systems are put under additional strain, responding to the complexities of COVID, or just delivering the routine services that we always did in behavioral health, with now the added set of protocols and standards to maintain safety around COVID. We're also concerned about older adults and those with cognitive decline or problems, and many who need assistance with self-care. How are we reaching out to our older family members or neighbors in the community and making sure that people are understanding what's going on, are feeling safe, are feeling cared for, and are able to care for themselves or have others help? A third population, people at risk of sexual or gender-based violence. We're learning and seeing that domestic violence and child protective are going up during these times of COVID and social distancing. All of the stressors that we talked about in the family on the previous slide, if you add into that complexity of a history of violence or any sort of coercive relationships, and you have a pretty difficult recipe, and an even more difficult time for people to reach out for help. And the last population that is critical that we pay attention to is children and adolescents. Kids have gotten their schedules greatly disrupted. Activities, socialization has changed. If you're following some of these articles in the paper, I've read recently another round of pleads from our state's athletic coaches about variation in the rules and how kids can get together or not. And the impact of this in that sort of narrow band of kids that had previously functioned with a great deal of structure and connectivity through organized school athletics. In the absence of that, we're seeing pretty measurable and noticeable changes in kids relative to anxiety and depression and feeling a lack of connectedness. We had a young man here in the Brunswick region that suicided here in the last 3 months, really citing his lack of connectivity and not participating in football as a significant stressor for him. I loved one of the comments I read from a middle school health teacher who said, this is an important reason why when we do the mental health sections in middle school, we talk about diversity, of not having all of your eggs in one basket. What would it be like if the one thing that you identified the most with was no longer available? What would you do? Right, and encouraging kids to join some different activities, different peer groups, and to really diversify the things that help define them. It's really difficult, right? And I pulled this quote because this is from a 15-year-old, and I thought it was pretty insightful and pointed, and also just sort of makes you realize what it's like, right? And so this kid said, it's like we've been acting depressed for the last 9 months, but supposed to know how to not become depressed. I feel so far away from the way I think I was perceived by my peers. I had one semester of 9th grade, and I haven't seen anyone since unless it's on Zoom. I have no idea what anyone thinks of me, right? And as adults, I think we can hear that and we can sort of say, yeah, that's tough, and that's sort of the way things go the older you get, and you really define yourself and all of those things. But our kids are developmentally not there, and they're not necessarily supposed to be at that level of detachment and sophistication. There's a whole series of youth community events coming up in the coming month about what's called mattering. And that's because 50% of the kids in the statewide youth survey said, I do not feel like I matter in my community. I don't feel like I'm connected or contributing. That's a pretty staggering statistic from this past year, and really underscores the importance of how kids really do need to feel like they matter and they are connected to something. So how do we see this revealing itself or playing out in substance use, misuse, and dependence? And I think the place we want to start here is just defining the difference. Substance use is defined as recreational or social use of a substance where the person does not experience negative effects or consequences. Drinking alcohol within defined health limits, which is between 7 and 10 standard drinks per week for an adult. 1 to 2 cups of coffee per day. Though there have been recreational cannabis laws enacted in many states, such as Maine, according to the National Institute on Drug Abuse, 1 in 7 users recreational of cannabis does develop a cannabis use disorder. These are sort of things that are set throughout our society through norms. And because we understand the impact of excessive drinking over time in healthcare, this is where those sort of defined limits come into play. Then we have substance misuse or abuse. And this refers to the use of a substance for a purpose that is not consistent with the legal or medical guidelines. Often we can help define this with prescription medications. This could mean taking more or less than prescribed. It could mean taking a medication that is not prescribed to you, or taking a substance at a time when obligations are inconsistent with its use. When we talk about opioid overdoses, this can be a difficult concept to understand. Many of the deaths or overdose responses that didn't result in death in our state and nationally, we have sort of an image of these are people with an addiction, a substance use dependence disorder. And the reality is a fair number of these are folks that have misused or abused a substance. They're not somebody that has previously demonstrated dependence or addiction, but obtained a substance, oftentimes not knowing that there were things contained in it that would be dangerous, such as fentanyl that is now involved or found in cocaine, or some of the club or rave drugs like Molly or ecstasy that now they're finding fentanyl in that. And then we have substance dependence or a substance use disorder. And the lines between abuse and dependence can easily become blurred in the presence of chronic or daily regular use. The way we sort of ferret this out is when regular use results in one of the following, a professional assessment may help identify and intervene. So if your substance use or abuse is resulting in health complications, your inability to carry out daily responsibilities, physical dependence as evidenced by a withdrawal symptoms, or you find yourself craving or preoccupied. These are signs that has a relationship with substances that has moved from perhaps misuse into a use disorder or dependence. And this is when we strongly encourage people to reach out for help. And you can do that through a number of resources, which Dr. Munore will review with us. So some further statistics around this that I think help exemplify what's happened with substance use during COVID. I think some of these are kind of shocking. Alcohol sales nationally are up 262% in 2020 compared to the previous year. Just let that sink in. That's a substantial financial gain during a time when nobody's really traveling. And maybe one of the contributing reasons why the number of miles we're driving in Maine has dramatically gone down month by month over the course of social distancing, but the number of accidents and injuries have gone up. So much fewer people on the road, more accidents and injuries. I always, this is what we do. So when I see alcohol sales are up 262%, and I sort of wonder about that statistic about the increased number of injuries and accidents. In adults, 30 to 59, men are reporting an increase of nearly 14% consumption, and adult women an increase of 17%. In both cases, this represents one more day per week of consumption on top of an average baseline, which was already 5.5 days a week for men and 4.5 days per week for women. Right, and so we're moving much further into daily consumption, is what that looks like. For adolescents, the percentage of new users has decreased in almost all substance abuse categories during COVID-19. But for those who previously used cannabis or alcohol, the frequency of use has gone up substantially. And a part of that is really norms, and we'll talk about that in the next slide. 49% of those kids using substances report using alone. Solitary use in kids has increased substantially. And 31% or a third report using with peers virtually on video-based apps such as Instagram, Google Meets, or Zoom. So yes, adolescents are huddled together on a Zoom room and virtually using substances together. Also important is that a quarter or 26% of kids report regular use with peers in face-to-face scenarios. And we recognize small gatherings that are not abiding by social distancing, masking, et cetera, are really one of the areas most driving our COVID positivity rates. And so these small groups, you're not wearing a mask when they're smoking pot together or passing a bottle. And these are things that we need to be thoughtful and concerned about. And lastly, again, for kids and adolescents report concerns about how social distancing affects peer reputation. This was a significant predictor in face-to-face use with friends among adolescents who self-reported themselves as having low popularity, and also a significant predictor of solitary use among those reporting average or high popularity self-reports. So you remember that quote from the 15-year-old that said, I don't know where I fit. I don't know what people think about me. Things like popularity and understanding where you are in your peer group is critical, an important part of how people define themselves. And so what we're learning from this is that perception from kids is really driving some of the risky behavior. And that's something that we need to be concerned about. So community and family norms have become more lenient of substance use during COVID-19. And I elected to just sort of put some images up for this slide to kind of underscore this. And I'm hoping, you know, all of us on the webinar today have been exposed to media such that you can sort of see for yourself some of the changing norms and really promoting through humor. Perhaps where the 262% increase in alcohol sales might be coming from. You know, we have Ina Garter here with a giant Cosmo, and I actually remembered seeing the episode where she made this. Hoda and Kathy Lee have pretty regular installments in the morning show around the consumption of alcohol. In the upper right, that's actually a Saturday Night Live skit that is about 4.5 minutes long. You can Google it, you can watch it. This came out around month 3 of social distancing, March, April, May, June. So like May, June of the beginning of this period. And, you know, it's a music video spoof of all of these parents struggling in the house with kids underfoot and competing priorities. And in many cases, you know, if you're stuck at home with your children for 3 or 4 months, some of our parents' habits and behaviors and things that they participate in become revealed, and they're much harder to keep secret. And that really is one of the reasons that's driven some of these changing norms. I couldn't forget Martha and Snoop's new work together around cannabis cuisine. And we do see a lot of changing norms in our state about the medical and recreational nature of cannabis. And these are just more sort of examples of how these norms are shifting. And lastly, I came across this every Wednesday podcast / webinar that was really from these veterinary viewpoint, right? Where veterinarians are saying, you know, we're having an increased volume of customers that are coming in who are day drinking or high. And let's take a few minutes to sort of talk about how in our field, how we're addressing this phenomenon. And I think those are just some very clear examples of how these norms are shifting, and oftentimes through media, entertainment, and humor. And I don't think we often know or really pay attention to the gravity of that kind of humor. And I think it's just worth taking a look at. And I think just a couple more slides, we would not be doing service if we didn't talk about the role of stigma about having substance use disorders and seeking help, because these have in fact gotten worse during COVID-19, right? Stigma refers to negative stereotypes. We define this as an attribute, behavior, or condition that is socially discrediting. Discrimination is the social behavior that results from the stereotype. The above represents societal baseline reflecting attitudes and beliefs about substance use disorders and those that struggle with them. So those first 2 bullets are just where things were with stigma and substance use before COVID. During COVID, those needing help really have an amplified stigma regarding how they acquired this problem during a time they should be socially distant, thinking of the greater good and community, family, and limiting activities to essential errands, right? This is sort of our mantra. And so if you add to that, you know, I've been engaged in some behaviors that may be outside of some of those values and norms. You see how that just amplifies the difficulty. And I chose to try to articulate this with some of these quotes, right? Not only do I have this problem, but I need help for it during a time we are all supposed to be making do and mending. not going to the emergency department for an overdose, withdrawal, or a substance-related accident. We're supposed to protect our first responders and healthcare workers by not needing them right now, right? And that is sort of an underscored community sentiment. And if you need folks' help, and you have this condition with all of this already, social and familial and self-stigma, you get the dynamic of how much harder it is to own that and ask for some help. So I'm going to stop there and stop screen sharing. So Susie, who will be coming on next, can talk with us about part 3, as well as Dr. Munore.
Hello, I'm Susie McKenna. Nice to see you. I'm just going to share my screen real quick. Probably easier said than done, but I'm going to do my best. Okay. How's that? Perfect. Okay, so I'll just briefly start. Dr. Munore is going to touch on some stuff here, but this is coping during the pandemic, stress and substance use, misuse, and substance use. So this is our, I've loved what Eric has put in the training so far. It's been eye-opening, even as somebody who works in the field. So, none of us are immune. So part 3, healthy ways to face stress. What do you do when you need more? And resources for help and education. So I'm going to just start briefly on touching on relapse warning signs. So we're talking a lot about substance use disorder, people who struggle with that, the stigma around it. Stigma is still the biggest barrier for a lot of people seeking treatment, including especially women, parents, mothers. So when we're looking for relapse warning signs, it actually, it's very helpful to be aware of yourself or someone else that you love or know, and just sort of keep your eyes open for these things, because nobody intends to do this. This is nobody's like, I'm going to wake up this morning and do this. So be aware, look for things like isolation. If somebody is no longer spending time with people that they used to spend time with, healthy people, that's a red flag. Loss of interest in recovery activities and programs. We have a plethora of options these days for support groups and ways in which people can define their recovery. And when you start to lose interest in that, it's a pretty big sign that you might be headed in the wrong direction. There's a great phrase that I heard: if you're coasting in recovery, you're going downhill. So I like that one. So if you're losing interest in recovery activities and programs, that's a big sign. Spending time with the people, places, and things that were part of the substance use disorder. So we say you only have to change one thing, everything. Like your people, places, and things. Those are unhealthy environments and unhealthy people, not because they're bad people, but just because they're in a different place. So if we're finding ourselves spending time with those people or going to one of those places, that's a big sign. There's another phrase that you can only go to the barbershop so many times before you get a haircut. So you may be going to hang out and be, just present, but it's a slippery slope. So talking about one's ability to control and participate in that lifestyle without it becoming a problem again. So, the sort of one more time talking, I could just do it just this once. Nobody's here. So that's a pretty big red flag. Glorified thinking. So some people might confuse this with like sharing on your experience, strength, and hope, but glorified thinking is really sort of just looking back on the days of active use, like, boy, that was a good time. It's really easy for us to forget all the terrible stuff and remember, the one or two fun things. That's just like the nature of addiction. So depression and changes in sleep and daily living patterns. So some of these, like depression and isolation, are bigger picture things that may not be prevalent. You may not notice it right away. So one of those things is just being aware of somebody's triggers. So like if their triggers are people, places, and things, and you know that, and they're going to go spend time with those people, you know, that's something you might want to consider a warning sign. So depression, again, a very common trigger. So there's some crossover between relapse warning sign and triggers, and that's how it is. So if you are noticing warning signs or seeing that people are being exposed to their triggers, you know, that's something you might want to, in an appropriate way, address. Thank you so much. I am going to move on here for Dr. Monroe.
Thanks, Susie. I'm just going to sidestep a little bit and pick up on where you left off. But what I want to talk about to start with is just what can we do when we start to feel like this isn't normal. And I would say this applies to every person because things aren't normal. So just some basics of healthy ways to face stress. These are the things we talk about all the time. And I think we talk about them, but we don't necessarily really put them into practice. So I just want to go through a few of these things. Number one, practicing good sleep hygiene. If you Google sleep hygiene, you're going to come up with a list of things, and they are these. Establishing regular sleep schedules and sticking to it. That means on the weekends too. And boy, do I see a lot of kids who could use this help. I think the one thing that unites most of the kids, especially the teenagers that I see, is that when school stopped for them on a regular basis in the spring, they stopped going to bed at a regular time, and they're up at night and they're talking to their friends or they're texting because they don't have that early alarm clock necessarily to get up for. And we just started seeing that sleep routine really change for adults and for kids. So that's very important, and sticking to that. Limiting exposure to light close to bedtime, you start to decrease the cues that it's bedtime, that it's nighttime when you do that. And screens are our enemy at that point. The light from screens, even the phone, can really turn down that body's process for knowing that it's time to sleep and settling down your brain. Avoiding things like alcohol, nicotine, caffeine, all of them can interfere with sleep. People will tell me that they, some cigarette or alcohol might actually help to relax them in the evening and help with sleep, but it actually does interfere with getting good sleep and getting into a good pattern of sleep. And so we try to avoid those things. Having your sleep space be clean, comfortable, dark, cool, ready for a sleep, ready for calm. I tell people, go for those lavender scents if that's calming to you. Bring in those things that make that kind of a close and quiet place to be. And I put this in here, your bed is a bed and not a desk, because as we've all moved to sort of home offices and homeschooling and socializing on screens, we're finding ourselves in our bedrooms or in other spaces using it. And so some people have really no reason to get out of bed in the morning because you can work from there and you can eat from there and you can do everything that you need to, but that really does interfere with being able to get sleep later on in the night. So get out of bed and make a desk space for you. Healthy diet, that old saying, you are what you eat. It's true. The reason it's been around for so long is because it's true. If you put junk into the body, you can't really expect the body to act the way that it's supposed to heal and face the stress. Exercising every day. It doesn't have to be, the tremendous workout every day. You don't have to go run a marathon, but doing something, increase your heart rate, get your muscles working. It increases your endorphins. It lowers your stress. It will improve your sleep. I tell people this all the time, and I love it when people come back to me and say, I tried it and it worked. And I say, imagine that. It actually was something good to say. Another one, connecting with nature, getting outside, seeing, the wind blow the leaves in the trees, looking at, a squirrel running around. That actually will really help to bring things down for us and get out of our own heads and our own worries. Following routines. that allow you to log out of work and engage in other activity. Again, our homes have become our space to do everything. So it's very tempting to leave your email up on, the kitchen table, to leave that, oh, let me just do one more thing before I go to bed, one more, email, one more check at my schedule. I really would encourage people to not do that. It sends you, that time that you can log out and then be present for your family, be present for your own social side. And it also sends a message to your coworkers that it's okay for them to do that as well. We give them the message that it is okay to end a work day and to actually have a life outside of there. I think that's really important. Practicing mindfulness, we talk about this a lot. I don't know that many people really know what that means, but I can give you an example from the springtime when things started really to ramp up in the pandemic, and our offices were inundated with emails and changes and things that were, now you're going to wear this type of mask. Now you're going to, sit in this seat for that. You have to keep this amount of distance, and all of these things. We were getting tons and tons of them. And it was really hard to just kind of live in the moment and do what we were being asked to do. And I think that goes for everyone. I found myself saying, the things I'm worrying about for tomorrow, when tomorrow comes, they've changed. Right. And so I worried for a whole day over something that isn't even the thing anymore. And so it's easier said than done, certainly, but to try to just kind of live in where we are and connect with the people that are around you. Consider doing things like a gratitude journal, something at night, stopping for a few minutes to say, what am I grateful for? What good thing happened to me today? What, a good smelling dinner, or, a friendly smile, if you could see one under a mask. You can do these journals in writing, you can do them in photos or drawings, just something to kind of connect you back to what you're grateful for and what good there is. You could also make that a dream list. What things do I want to do as a family when things get back to normal times. Apps, there are apps for this. There are apps on the phone, which is what we're trying to get you away from sometimes. So I usually recommend just the good old fashioned pen and paper and trying to get away from the electronics a little bit. Also reaching out to friends, social networks. Virtual connections are great, but again, sometimes it's good just to try to be outside. So maybe get outside and go for a walk, or just be with people in a distanced and safe way. But if you are going to do virtual, try doing something other than just talking at each other or drinking with each other, or other substances, right? Playing a game together or cooking together. My family has been watching plays or movies together. We just watch it, hit play at the same time and we're on FaceTime together, and that's been a nice way for us to connect in a different way. And I'd like to do a shout out to the Choose to Be Healthy website. They have a really great section on their page right now that has some helpful tools and ideas, and I think that's definitely worth everybody taking a look at. And thank you to them for doing that for us. But Susie, could you do the next slide for me? Thanks. But sometimes we need more, and we need more than those things that we can do. And I wouldn't say we should stop those things and do more. I think we should do all of it. But there are some things that we can do when we need some more help. One of those would be certainly your primary care provider. I am a primary care provider, so I come to this, wholeheartedly. Don't forget us. We want you there. We are safe. We are places where you can come. We will check you and screen you and make sure that you are, safe in our building, but we want you to be there. We're going to do the things that take care of you routinely, and we're going to do screenings to see if you are crossing the line between substance use and misuse, if there's something else there that you need to talk about. We're screening for depression. We know how hard it can be, and we're a connection for you. So please come in. We're there for acute care. If you do wake up in the morning and decide today's the day and I'm ready to talk to somebody, I hope that you find your primary care office to be that welcoming place for you. We are a safe space, and we can get you into treatment, to therapy, and medication if needed. Our emergency departments are also a place to go for help. Certainly evaluation and treatment of withdrawal and acute care. They have access to crisis services. We have crisis intervention right in the emergency room. In terms of opioid use disorder, you can get your first dose of medication right there in the emergency room. Certainly admission if that's necessary, or connection to other options for treatment and long-term care. And they will talk to you if it's a substance use disorder, alcohol use disorder, comprehensively. Most likely will point you in the direction of our recovery center here at York Hospital. What does our recovery center do? Could you go to the next slide, Susie? Thanks. So the phone number's there, 351-2118. We do take care of all substance use disorders. We have as Susie used, a plethora of options with one-on-one counseling. We have an intensive outpatient program and several outpatient group opportunities for continuing care, early recovery, skills building, and women-specific groups or gender-specific groups. We also offer medication for addiction treatment. We provide buprenorphine, or what people know as Suboxone. We are really focused on rapid access to care and getting people in quickly. You will get a friendly voice on the phone and connection to help. And we can link you to other things: primary care, psychiatry, the help center, and certainly we're confidential. I have one more slide there. I just really wanted to not go further without talking about Naloxone or NARCAN, because I think it's really important for us all to have access to it and to know what it does. It saves lives for sure. It temporarily reverses the effects of opioids when somebody has had an overdose situation. It doesn't have an effect on people who are not using opioids, and it also doesn't have no negative effect. So it can be used even if you're not sure if that's what somebody has used. It can be administered by friends and family members, and it's easy to use. I have one version of it right here. It comes in a box with a little nasal spray that pretty much anybody can learn how to use very quickly. And where to get it would be, back to your primary care office. Walk-in cares have it. The pharmacy, many of the pharmacies in the area don't even require a prescription for it. So you can walk up to the pharmacy counter and get it. So let's talk about NARCAN. Let's keep it with us, and let's know where to get it. Pass it back to you, Susie. Thanks.
Thanks, Dr. Monroe. So yeah, I love the part on NARCAN there. I keep it in my car, in my purse, in the house. You just never know. So thank you, doctor. So I was just thinking about my list here, and I forgot one of the best coaches, recovery coaches. I'm a recovery coach. I should have put that on this list. That's terrible. Because I actually think that it is a really good tool for people, early recovery, late recovery, whatever. Just to figure out what your path to recovery is. So I am part of the school of thought that there is no magic formula to find recovery and stay in recovery. If there were, we would all be there, because it's a pretty terrible existence. But there isn't. But there are a lot of different choices, and some things work for some people and some work for others. So I am, of course, part of York Hospital and the Recovery Center, and I'm also part of PRCC here in Portland. So that is Recovery Community Organizations. And PRCC is an example. There's also a Triangle Club, Southern Maine and New Hampshire. There's the SOS, and those are all different, obviously, community organizations that have different meetings. And obviously with COVID, that has really put a damper on things. So PRCC normally has, a couple meetings an hour. There's just an unending amount of meetings and resources, and we're closed right now. So we've got some virtual meetings, but we really miss being able to do the in-person work, as I'm sure people can relate to. So recovery community organizations, all recovery. Now that's something that I think people could benefit from, especially people on MAT, medicated assisted treatment. My story included MAT, and I struggled in the 12-step fellowships early on. I just didn't connect. And that's not everybody's story. I love the fellowships. All recovery is a great meeting that has, you know, it could not even be drugs or alcohol. It could be a food disorder. And it really just allows people to share openly with no parameters around what it's okay to talk about. Then there's Alcoholics Anonymous, which many people have heard of. The fellowships are incredible. Narcotics Anonymous, Heroin Anonymous, something called Smart Recovery, which I just think is one of the best, really. I do think it's one of the best because it's cognitive based, and it really, you know, it's nice to see things sort of laid out, you know, how our thoughts and our actions affect the rest of our lives. And that's such a great part of Smart Recovery. So I really pull from all of these, and I find that people with, I don't want to say successful recovery, because recovery is recovery, but people who I find are finding joy in their recovery are using these resources. So however people want to do it. So Hope Group is a really cool group, and I'll just read to you about it. It's based on attitudinal healing, a cross-cultural method of healing that helps remove blocks such as judgment, blame, shame, that are in the way of experiencing lasting love, peace, and happiness. That's something that we do at PRCC, and it is a virtual, it is available virtually, like all of these other things. All recovery is available virtually, AA, NA, HA, Smart Group. And I did mean to begin this with telling you that I do have a document outline these resources and details. So if people would like that information, including links to these meetings. So I would love to share that with everybody. Al-Anon and Alateen, obviously very important for people struggling. When I was in treatment, they made us go to Al-Anon, and I just thought, this is insane. I'm the addict. I'm not the family member, but I was in treatment and I was living with other people seeking recovery. And that is just, you know, that's textbook Al-Anon, you know, you really, and it's pretty rare that I find someone in recovery who doesn't have anybody else in their sort of sphere that struggles. So if you do, Al-Anon and Alateen are really great resources. Marijuana Anonymous, there are a lot of shifting views on marijuana. I liked hearing that statistic, the 1 in 7. You know, I'm on the fence sometimes about the recreational use, but there's no doubt in my mind that it's a gateway to other substances. So that is a good group. Crystal Meth Anonymous, Wellbriety. Wellbriety is another one that may not be very familiar to people. It's a movement which seeks to break the cycle of hurt caused by alcoholism and other addiction, with an emphasis on native spiritual traditions. It has incorporated parts of the approaches of Alcoholics Anonymous and Narcotics Anonymous into a spiritually based, largely on modern Lakota, Lakota spirituality. So what Wellbriety means is to be sober and well. So I like that group. Recovery Dharma, which is a peer-led movement using Buddhist practices. Cocaine Anonymous, pretty self-explanatory. Drug Addicts Anonymous. And then PRCC and a lot of other organizations do things like yoga and Reiki recovery groups. And we still do them, even in COVID. They're virtual. And the links for that are all also in my giant document that I'd love to share with everybody. So I will hand it off for now, but I'm happy to answer any questions.
Well, thank you very much. That was an excellent presentation. Thank you to all of our presenters. And you did all outline a lot of resources for the audience, but we did have a question. We had one question that came in early on asking if maybe Dr. Munore, you can speak to, can you speak specifically to local parents who have concerns about their child's substance use, misuse, and how to get help?
Sure. And I'm going to point back to primary care. I think I would start there. I get a lot of questions about, I think this might be going on at home, but I'm not sure. And that's a really tough place to be as a parent, is just, trying to kind of walk that line of like, I don't want to lose the ability to talk it out at home, but, and stepping over. So I guess I would say simply would be make that first call to primary care. We can do some screenings. We can talk it through and see if there's an issue that needs further workup. Also, if you think that there's substances that are affecting health and it's an emergency, then certainly the emergency room. If you're seeing some things that are very concerning about withdrawal symptoms or something like that, and you think that certainly that is a place. And you could call the recovery center as well, and we could link you to those evaluations.
Thank you, Dr. Munore. We had a couple of questions that came in prior to the webinar too. This one sounds like it might be for Eric. How does medication-assisted treatment, MAT, work? How does one drug stop someone from craving another drug?
Sure, and Dr. Munore, please feel free to jump in as I respond to that. Medication-assisted treatment, one is sort of defined as the treatment of a substance use disorder with an FDA-approved medication. There are currently 3 FDA-approved medications for treating substance use disorders. For opiate use disorder, those are buprenorphine or Suboxone, which is the medication most frequently prescribed at the recovery center. There is methadone, which you would receive from a methadone clinic, or there is an extended release naltrexone, brand name known as Vivitrol. For alcohol use disorder, there are also a range of medications that are approved by the FDA. And all these medications work a little bit differently and are more effective with some populations than others, is sort of the first brush on responding to what is MAT and how does it work. Relative to the recovery center and the work that we're doing around opiate use disorder, including the prescription of Suboxone or buprenorphine, is really over time with someone's substance dependence, particularly with opioids, they develop a physical dependence, right? In the absence of that substance, there is withdrawal. The withdrawal symptoms can be very severe and traumatizing for folks. And that level of preoccupation, which is sort of a cornerstone of addiction, creates a compulsion that makes it really difficult for people to stop simply because they know it is the right thing to do. What the medication does initially is stop all of those withdrawal symptoms. When a person is no longer ill, they're able to employ some of the critical thinking associated with how am I going to now start to get better? So the first thing it does really is we call it helping someone get back on their own backbone, stopping the profound nausea, vomiting, muscle cramps, sweating, preoccupation, and compulsions. What it does over time with maintenance is really occupy those receptor sites in the brain that otherwise would be craving and preoccupied with continued use. And so a person does not experience a high or euphoria from these medications when managed correctly and dosed correctly. What they do rather is allow a person to fully function. And that would be sort of the simplest way that I would try to explain how MAT works. in terms of assisting people in their recovery. Anything you'd want to add to that, Dr. Munore?
I think an important thing to add would just be that it's safe in pregnancy, and in fact is the standard of care for pregnant women who are suffering from substance use disorder. And so you know, we've been so lucky to see some beautiful, healthy newborns, and even during this COVID time. And that was with folks that had gotten onto Suboxone early on, or even later in pregnancy. So it's okay, and please come in.
And I think just from a recovery rate standpoint, opiate use disorder without MAT, we see outcomes, not so great, like 1 out of 10 people engaging in sustaining and recovery. With the addition of medications, we see that number go from 1 to 10 to 6 out of 10, which is a substantial increase. And so we do want to avail people of, 1, it's the published standard of care, and 2, we know more people get better with the inclusion of medications than without.
Great. Thank you very much. I think we have time for one more question, and I did want to just let the audience know that we will be sure to send out an email to all of you on today's call with the link to Susie's resources that she mentioned. So we'll be sure to do that as follow-up. And the last question that we received, Susie, because you were talking about virtual resources and Alcoholics Anonymous and different recovery groups that have been meeting virtually, somebody had asked, how has virtual treatment been going during the pandemic? Do you find that people are more or less engaged than in person? Do you think that virtual treatment options are here to stay, or will the model go right back to in-person intensive IOPs when the pandemic ends?
That is a great question. I am finding that there's a real mix of people. Some people really prefer virtual. It's easier, they don't have to leave the house. But I think that at the end of the day, it isn't our best option if we have in person. So I do think that it will remain. It's begun, I think it'll be part of the new normal eventually. But I do think that it's much better to try and interact in person. That being said, we are not in a time where that's safe and a good option. So I think that virtual recovery resources and groups and things like the MAT groups are just unbelievably important. I'm incredibly grateful that there's a way to see people. It's really hard to help somebody with a substance use disorder if you can't see them, if you don't have any idea of where they start. And it's really hard. I've been coaching some people that don't want to do video, and it's hard for me to really understand what's happening just through a phone call. So while I think the virtual resources are really great and incredible, and I hope we keep getting more because this isn't going to really end anytime soon, I hope it just becomes a piece of the normal. I think it's a great opportunity for people who may not normally want to go out, or it's a great way to try something new. You can sort of shut your camera off and sit in the back, so to speak. But, and I think that's a really good resource for people, especially people new to recovery. But there's just no question that the human connection is just such a big part of a healthy recovery. So it's hard to do. We spend all our time telling people, just whatever you do, don't isolate. Like, that's just the worst thing you can do. And then we're like, surprise, you have to isolate for the next year. So it's a tough situation for people in recovery, especially early recovery, but that doesn't mean that it's, easy for people who have got some time under their belt. It's a mixed bag. I do think it'll stick around. I think it's a good option, and I hope it just becomes a piece of our new normal and not the whole thing.
Excellent. Well, thank you, Dr. Monroe. If you didn't want to add anything to that, I saw you shaking your head. Yes. Feel free to add something. Otherwise, we are at 1 o'clock. So the webinar is over. Thank you, all of you, for tuning in today and sharing this time with York Hospital. And we will email all of you those resources that Susie mentioned, and check our website frequently for more webinars like today. Take care.